Hey everybody, this is Levi again with you. I'm going to go over a quick video today on how to do an adherence task. So we come up here to the top left and click our Patients tab. I want to point out to you guys, if you want to sort for a specific task, you can do that now. So you can go up here, select type. Whatever task you're specifically interested in, you can select that here from the drop down. That'll filter a patient list just for that specific task. Or maybe you want to filter for a task you did on a specific date. You can now do that as well. So maybe you address a task on, say, June 1st. You can't remember who that patient is. You can now come in here and filter and try to narrow down that search and remind yourself who that person is. So that's a nice little addition that's got put in here. I already know this is an adherence task because I looked ahead of time. But once you get in here, it'll bring you into the patient's profile, and right underneath the task tab within their profile. And up here we can see what tasks need to be done and what tasks have been done. And so for this patient, we have a non-adherence call, and we can see the medication here and the strength. And then on the right hand side here, just a quick prompt of what's going on, and some claim history here, which is really nice. So we can see when the patient filled, we can see the day supplies for those medication fills, and we can also see the gaps in therapy here, which is nice. So you can kind of see, is the patient really not adherent? And once again, want to reconcile this with your dispensing platform, especially if it calculates adherence for you. And if the patient is adherent, you can go ahead and click yes. But if you do look into the dispensing system or reconcile it with whatever information you have on file there, and you decide the patient is actually adherent, you can always select no. And then you say adherent by our standards, or select whatever other reason that you don't want to complete this intervention here, or you can always select other and free type here a response, and then submit that, and that'll get rid of it for you. But if we do decide we want to intervene on this intervention, we can go ahead and click yes. At the top, we've got some of the most common talking points for the non-adherence tasks that we've identified, such as assessment of the patient's medication supply, assessment of understanding of medication, developing the medication care plan, maybe some new medication education. Perhaps the patient started a new med and they were unsure if they were supposed to continue on with this medication. Also some new medication compliance assessment, bullet points down here for you guys. Just trying to increase the overall efficacy and accuracy and save you guys as much time and document your clinical services and the services you provide to your patients. Some new medication education selections here. So if you talk about dosage, efficacy, administration, maybe that new med that they started or unsure if they're supposed to continue on with this one. General assessments, maybe medication regimen knowledge, medication compliance. They know they need to be taking this every so often and for what reason. Medication reminder setup, maybe provision of medication list. Maybe someone just needs a set of directions that they can kind of reference on a daily basis. And then once again, you can select here who you spoke with. So if you spoke with the patient, maybe you spoke with their caregiver, or perhaps you spoke with their primary care provider. And then once you select all these here, you can go ahead and complete the task, and that'll log that there underneath the patient's history. That wraps up this short video on our non-adherence task. If you guys have any questions, shoot us an email below or reach out to us through Intercom. Thanks.